Hi everyone, Dinesh Surasena here, and today we're going to be talking about imaging the anterior hip joint. As with my previous videos, I recommend the ESSR guidelines on musculoskeletal imaging. In this situation, I recommend the hip guidelines. And here's the images from the ESSR guidelines for scanning the anterior hip joint. Ideally, the patient is placed in a supine position with the anterior aspect of the hip joint exposed. You can place the transducer in a longitudinal orientation, and this is what you should see. You'll see the acetabulum, the femoral head, the femoral neck, and if you go medially, you should see the iliopsoas tendon. When scanning the anterior aspect of the hip, again, I'll have the patient lying supine. I try and expose the area as much as possible, but preserve their dignity by covering them with a towel. In situations where the hip is particularly deep and difficult to scan, you might try and extend the hip by lowering the lower portion of the bed. In this way, you bring it more superficial and therefore make it slightly easier to image. Typically, when I'm scanning the anterior aspect of the hip, I'll use a curvilinear transducer. The reason for this is it gives me a much wider field of view and also tends to be much lower frequency. It therefore allows the hip to be visualized much more easily. A linear transducer can also be used, but I would recommend using a lower frequency probe. And this is what you'll typically see when scanning the anterior hip. You'll see the femoral head, the femoral neck, the acetabulum, and the anterior joint. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and share with your friends and colleagues. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.